Today, we're discussing the recent outbreak of human metapneumovirus, or HMPV, in China. Many of you have questions like, is this another COVID-19 or should we be worried? Let's break it all down, address your concerns, and separate fact from fear. What is HMPV? Let's start with the basics. HMPV is a respiratory virus first identified in 2001. It causes illnesses that range from mild cold-like symptoms to more severe respiratory issues like pneumonia or bronchiolitis, especially in children, the elderly, and people with weakened immune systems. But here's the key difference between HMPV and COVID-19. HMPV has been around for decades and follows a predictable seasonal pattern, much like the flu or RSV. It is not a novel virus, and the scientific community is familiar with how it behaves. What's happening in China? Recently, China has reported a spike in HMPV cases, particularly among children under 14. Hospitals are experiencing an increase in patients with respiratory symptoms, and naturally, this has raised public concern. However, experts believe this rise is part of the usual seasonal trend for respiratory viruses, not an indication of something as globally disruptive as COVID-19. Is this like COVID-19? I know what you're thinking. Is this another pandemic? The short answer is no. While both COVID-19 and HMPV are respiratory viruses, here are three key differences. 1. Transmission. HMPV spreads through droplets from coughs and sneezes, contaminated surfaces, or close contact, just like COVID-19. However, it's not as contagious as COVID-19. 2. Severity. COVID-19 can cause severe illness in otherwise healthy adults. HMPV, on the other hand, is more likely to cause serious symptoms in vulnerable groups, like young children, older adults, or those with chronic health issues. 3. Global impact. COVID-19 was a novel virus, meaning no one had immunity and it spread rapidly. HMPV has been circulating for decades, and most people have been exposed to it at some point in their lives. So while it's natural to feel anxious given the recent memories of the pandemic, HMPV is not expected to have the same global impact. Addressing public concerns. Now, let's tackle some common questions I've been hearing from people. 1. Should I wear a mask? If you're in a crowded area, especially during flu season, wearing a mask can help reduce your risk, not just for HMPV, but for other respiratory viruses too. 2. How do I protect my kids? Encourage regular hand washing, keep them away from sick individuals, and disinfect shared surfaces frequently. If your child has symptoms like wheezing or difficulty breathing, seek medical attention promptly. 3. Could this virus mutate like COVID-19 did? Viruses mutate all the time, but HMPV has shown no signs of mutating into a form that would drastically change how it spreads or causes disease. So there's no need to worry about that right now. Symptoms and when to see a doctor. Symptoms of HMPV include runny nose, cough, fever, wheezing or shortness of breath in severe cases. Most cases resolve on their own with rest, fluids, and over-the-counter medications. However, if you or a loved one experience severe symptoms like difficulty breathing, seek medical help immediately. Prevention and next steps. While there's no vaccine or specific treatment for HMPV, you can reduce your risk by 1. Washing your hands regularly. 2. Disinfecting frequently touched surfaces. 3. Staying home if you're feeling unwell to avoid spreading the virus. The good news is, HMPV is manageable, and healthcare systems are well equipped to handle outbreaks like this one. Final thoughts. While it's important to stay informed about the HMPV outbreak in China, there's no need to panic. This is not another COVID-19, and simple hygiene practices can go a long way in keeping you and your family safe. Thank you for tuning in. If you found this video helpful, please like, share, and subscribe to Understanding Medicine. Let's continue spreading knowledge, not fear. Take care, and see you in the next video.